Thank you so much for attending the first Walk and Learn session of the summer. While listening to our speaker today, we encourage you to get active and walk around during the session. My name is Sanyia Kodavarti. I use she, her pronouns, and I'm a rising junior in college spending the summer with Rush's Community Health Equity Department. My favorite form of exercise is probably taking walks when it's nice outside or attending a spin class when it's not. I would now like to introduce our wonderful speaker for the day, Zinal Agnihotri. She is the Clinical Program Manager of Integrated Mental Health and Wellness in the Department of Social Work and Community Health. She supports a team of clinicians who provide mental health services to patients throughout the Rush system, including partnerships with other departments to help close the gap to accessible psychotherapy services. She completed her undergraduate studies at the University of Illinois, Chicago. She then went on to complete her master's in social work in California State University, Bakersfield, specializing in gerontology and medical social work. She has experience working in various medical settings and working with a diverse range of patient populations. She also enjoys providing trainings and mentorships as a part of her role, and completed her residency in physical medicine and rehabilitation at Rush University Medical Center in 2012. Thank you for joining us today.
Thank you so much. And thank you all for spending the next hour with me today. We're going to be talking about the importance of the mind and body connection and how our physical health and our mental health are all connected. Before we actually get started, and I know this deviates a little bit, I would like for everyone to actually slow down for a second. I recognize that you were just asked to move while you are in this walk and learn, but we're going to slow down. I'd like for everyone, regardless if you're standing or sitting or whatever position you're in, I'd like for you to just take a moment, slow down your movements, and really get grounded where you are. If you're able to get your feet nice and firm into the earth, if you're seated, to have your sit bones nice and firmly into where you're sitting. And as you start to ground yourself, we're just going to go ahead and let go and get slower and slower until we're feeling like we're paused. And as you're slowing down and grounding, I want you to start kind of paying attention to your body. Just notice what you're experiencing today and in this moment. Maybe you're feeling really light, flexible. Maybe you're feeling some tension in a certain part, or pain, or kind of heavy. We're not looking for the why. I just want you to notice and then put it into your memory. Now we're going to check in with how we're feeling mentally and emotionally. So check in with your mind. How is it feeling? Is it rather quiet? Is it buzzing? Is it racing? Again, we don't need to know why. We're just paying attention. And how are you feeling emotionally? Feeling pretty calm. Maybe you're agitated, restless, happy, excited. Again, not really determining why, but just noticing what's coming up for you in those three areas. Go ahead and put that into your memory. We're going to come back to it when we're done with our breathing exercise. So don't put it too far off into your memory, but just remember what that experience was like checking in. So I'm going to give us a prompt. We're all going to do this breathing exercise together. And I'm going to set my timer for a minute. So we're going to do this for a minute as well. I'd like for everyone to take in a nice deep breath when I say in through your nose. And when I say out, you're going to slowly release the air. And feel free to go at your pace if my pace doesn't feel comfortable for you either, okay? All right. So we're going to go ahead and start. Go ahead and breathe in and out. In, 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 out. Great job, everyone. Thank you for participating in that with me. We're going to do a quick check-in. How do you feel physically? Check in with your body. Is that tension potentially still there? Are you still feeling flexible or light? If there was any pain, is it still there? Is it any different? I'd also like for you to now check in with your mind and with your emotions. Same thing. If you had a chatty mind before we started, what is your mind like now? If there was a certain feeling that you had identified before we started, is it still there and at the same intensity? So we'll talk a little bit more about why I started this presentation with this exercise a little bit later. So I'd like for you, I'd like to invite everybody to go back to their movement as we continue on with the presentation. So a couple of stats that I think are incredibly important, how the stress that we're all kind of experiencing is impacting our health. In 2022, 59.3 million people were living with a mental health illness. And then 1/5 of US adults experience some kind of co-occurring mental health and physical health issue. Now, this is not accounting for folks who have not recognize their symptoms. And so maybe they haven't sought out any treatments, maybe they don't have access. So I don't know that 59.3 is the most accurate number, but that's a lot of people who are dealing with not just mental health, but also that physical health and mental health kind of co-occurring experience. And so that's why this is so important for us to have a better understanding of our mind and body connection. So let's talk about how stress impacts different parts of our bodies. When someone is experiencing stress, and I'm not just talking about one particular situation that might have happened, we're talking about kind of chronic stress. So someone that might be dealing with lots of different socioeconomic issues, an individual that might have lots of symptoms of maybe depression or anxiety, someone that may have lots of different health concerns, or their caregiver. I mean, there's so many different scenarios that we all may be experiencing, or folks are just experiencing in general that can lead to stress. And so what happens when somebody is experiencing long-term stress? Within the nervous system, this can actually start to impact sleep disturbances. It can either cause or worsen symptoms of depression or anxiety, for example. We also have the cardiovascular system that gets impacted. So people become at risk for hypertension, for example, or other types of heart disease. The immune system is something that gets impacted. When someone's experiencing fight or flight, and if it's chronic, it creates a vulnerability to fight off infections. There's different parts of our bodies that need to activate and or pause so that fight or flight can get can do what it needs to in moments of stress. And the immune system is actually one that needs to pause so that other systems can kind of take over in those moments. And that's at a long-term kind of experience can make you more and more vulnerable to those infections and fighting off illnesses. The digestive system gets impacted, can lead to IBS or other stomach related issues. We have the musculoskeletal system. This can lead to headaches, migraines, different type of chronic pain. The endocrine system. This really impacts stress can impact. And so we also have the potential of type 2 diabetes, weight gain, right? It impacts the reproductive system, can lower libido, and can also impact fertility. So we recognize that different types of stressors can lead to these experiences that just biologically change within our bodies, but the long-term impact of experiencing stress often can lead to all these different physical health issues that just kind of add on to our mental health as well. So when we're thinking about really making a stronger connection to the mind and the body, there are several different things that we can kind of start to do just to bring more awareness. Because I think one of the biggest pieces and the place that you can start first is just bringing awareness. Because if you don't really know how to hear what your body or your mind or your feelings are trying to tell you, then it's going to be hard to make those changes. So really the first piece is working on awareness building. So let's go back to that breathing exercise that I had everybody do. It wasn't just the breathing exercise. It was the before and the after check-in that was also just as important as the exercise itself. We checked in with how we were doing before, and we did the breathing exercise. And then I asked all of you to notice if there was anything different. Now, I also recognize that that was just 1 minute, right? But I am curious, and if people want to put this into the chat, did anybody notice a difference even just after a 1 minute breathing exercise? I'd invite you to share your experience if that's something you'd like to do. But I will say, for me, right before as we were checking in, my heart was racing. I was feeling anxious about this presentation. I noticed that I was feeling pretty tense, especially in my chest and in my arms. And then we did the breathing exercise, right? Afterwards, I was feeling a little less anxious. My body felt a little less tense overall. And I noticed that my heart was still beating a little faster than it normally does, but it had significantly decreased. So it made it easier to kind of continue with the presentation versus being as anxious as I was when we first started, right? And so if doing a breathing exercise or also a body scan, that's kind of what we had done when I asked everyone to kind of just check in with your body. By doing body scans, breathing exercises, mindfulness exercises, this all allows us to kind of slow down in a moment and just listen, right? I also asked everyone to kind of put away the why. We weren't really curious about why you may have been feeling a certain thing. We were just noticing. And so I think it's really important that when we're doing some of these exercises, there's a time and place for the why. Well, if you are really trying to make that connection between what your mind is experiencing and what your body is experiencing, we want to initially put away the why. Try to really just experience and notice what's coming up for you. Right? I want everybody to imagine the last time that you engaged with a baby. maybe like a baby that's around, 9 months to a year. Right? Babies are the best example of mindfulness living. Um, they will express to you when they're hungry, they'll cry, or they'll start to fuss if they don't feel good, right? They will use whatever type of communication they're able to let their caregivers know. Otherwise, they laugh when something is funny. They're very observant when something is super observant. They're not judging any of their experiences because they don't know how to yet. Um, what we really want to try to do is channel your inner baby, right? Channel that experience of just noticing, paying attention so that you can really hear what your mind tells you, what your feelings tell you, and what your body is trying to tell you. When we're able to do more of these things, listening to what is going on, you have the ability to then problem solve and act in ways that feel more valuable to you, that feel more meaningful to you, and also allow us to potentially deal with some of the other stressors that are coming up in a different way, right? Doing a breathing exercise isn't going to make someone's trauma go away. It's not going to make your depression necessarily going away. It's not going to take away chronic pain from a particular diagnosis. And I recognize that. But if it can help to even alleviate a little bit of that stress that we're carrying, then that in the long term actually helps out in those small ways, right? So if during the day, if you're able to do some form of movement, maybe you're someone that sits in front of a computer and does a lot of virtual work, um, getting up and stretching. Does your body just need to stretch for a moment? Maybe you're carrying a lot of stress in a certain place. Being out in nature can be really helpful for folks. Doing or engaging in some kind of meditation, and that can be from a spiritual standpoint, or that can just be meditating to a mantra that feels good to you, or a certain type of music that feels good to you. So these are just a couple of examples of how we can try to really start to improve that mind and body connection. And as we do so, I think that if we do it collectively or encourage each other to do it more collectively, we may be able to see some differences in those statistics that I had initially shared with all of you today.
Do you have any guidance on how we can teach children or teens about the importance of the mind-body connection and how we can implement that practice at a younger age?
Yeah, great question. I'm so excited for this question, actually. So it is so incredibly important. And if I had it my way, we would be learning these things in preschool and in kindergarten, and it would come in a curriculum in elementary school and high school and even in colleges. If we have to learn math, I really feel like this is just as important. And so, really very similarly, depending on the child and how old they are, can certainly just kind of modify your language in terms of how you would ask, but it's still very similar to how you would express it to an adult. Um, so I would recommend, right, just using language that's more kid friendly and saying, I'm noticing, let's say that the child is crying. I'm noticing that you're crying a lot. Um, can you tell me what's going on? Is there something that you're feeling in your head? Do you feel anything? Is there any, like, does it feel like there's some pressure? So you may have to offer a little bit, especially if this is the first time or the first few times that you're kind of going over with the child with this. So do you feel anything in your face? Are you feeling kind of warm? And then just kind of take them through their body really slowly. And as you're doing that, ask them to just take that breath, right? So if you have a child that's like overtly crying very heavily, then you're going to want to maybe even just start off without saying any other things. It's like, you know what? Let's just slow down our breathing. I can see that you're really upset. And doing that often, right? And it's not just for crying. If the child is angry, for example, or these are things that you're noticing, maybe they haven't actually said that to you, like I'm angry, but you're noticing that there might be some anger or frustration. Validate. First thing, just validate. I see that you seem upset, right? Um, how's that feel in your body right now? Is there a certain spot that feels really tense or really bad, right? If we're using kid-friendly language, is there a part that feels bad? And have them point to it. Maybe it's their stomach, maybe it's their head, maybe it's the whole body. And again, continue to validate. So kind of just saying, "Ugh, having your stomach hurt and being really frustrated feels really hard. I can tell that you're really working hard right now." So going through a body scan, something to that nature, and then incorporating the breathing exercise. So right, doing the slowing down of the breath, and then keep doing it, or you may have to go back to it. So one of the things that I always tell folks that I work with is when it comes to any kind of skill or technique that you're doing, it's not just a, oh, I did it and then now I should feel better, right? You may have to do it for longer than 5 minutes or 10 minutes, or you may have to do one series of 2 minutes and then go back to it another 20 minutes later, right? So it may be something that you have to repeat or do for a while until you notice a change in your body. But I would always encourage just kind of like that slow down process, giving prompts as needed, depending on the age of the child or their development. Um, and the validation throughout and just kind of normalizing that it's okay to have whatever experience you're having, right? The thing that we control is how we react to it, not necessarily what is exactly going on in our bodies.
Yeah, thank you so much. I think that was a great response. We have two more questions right now that I see.
Yeah.
So it's from Tammy, and it's how do you recognize that your mind is under too much stress before you start having serious medical issues?
That's a great question. Now that's going to depend on each individual, right? But one way to maybe start to gauge that or have more awareness to it is how does your how does your body react to the stress that you're experiencing? But how chronic or how often is that happening? If you're experiencing, a situational thing and then maybe that's over in about a week or two. And that week or two, you've been experiencing some stress. That's different than if you were experiencing high levels of stress every single day for 2 to 3 years, right? Um, and again, like I said, I think it's different for everybody. So a couple of things to do that inventory around is when you are under stress, how high is your stress? There's something that we like to use in our practice. It's not just our practice. I think like social workers or psychiatrists, psychologists use this often, but it's the SUD scale. It's a subjective unit of distress, and it can be 0 to 10, it can be 0 to 100, it can be 0 to 5. It's like whichever you choose, but whatever your number is. So I prefer 0 to 10. I usually say 10 is like so bad you need someone to call 911 for, you need to go to the hospital right away, right? If your experience of stress tends to be at those sevens, eights, nines, tens, and it feels like you're experiencing that daily or every other day for long periods of time, I would really encourage you to try to find ways to bring that down, because that's a lot for your body to have to experience um, on a frequent basis as well. Are there times where all of us have been at a 7, 8, 9, 10 out of 10? in our lives? I'm sure we have, right? The difference, though, for someone that's experiencing chronic stress that's going to impact their health versus maybe something situational is that frequency. How frequent are you in those 8, 9s, and 10s?
Great, thank you. And then I see one more from Taylor, and it says, can you discuss the impact of environmental stressors on the individual and the disparities in exposure to stressors and the stress response system?
Yes, of course. So stress is not just something that like we're necessarily doing unto ourselves. Um, there are certainly lots of things that are outside of our control that are within our environment that are going to impact your experience. And so really it's about kind of reframing and kind of thinking through, well, my environment or the experience that I'm in, I'm not necessarily putting myself in an experience where the stress is something I'm inviting in, but I happen to be in this environment where it is happening to me. And so, kind of thinking about, well, there are things that are outside of my control. What can I do for myself, either to reduce, even if it's just a little bit? If you went from like an 8 to a 7.5 in terms of your subjective unit of distress, that's still something. You are still giving your body a little bit of relief in that moment, right? So, like I said earlier, I recognize that a breathing exercise or doing a body scan is not going to take away um, some of the disparities that people are experiencing and or the socioeconomic stressors that people are experiencing in our world today. And what are some of those small things that we have within our control, right? So does it mean that instead of maybe um, you know, moving really quickly, can I slow down at all in any type of way? Can I do something for myself or for my body or for my mind in that moment where everything outside of me feels like it's completely out of control, but I can do something for myself? Maybe that's to drink water really slowly. If you're eating something in that moment, then can you slow down your chewing and just kind of give your body a break? So again, small little changes that are within your control to create any kind of relief to your mind and your body. That's what you want to focus on when it comes to external experiences that are just outside of your control.